Hello and welcome. As we continue looking at cardiovascular conditions, today we will learn about cardiomyopathy. We will be able to identify the main types of cardiomyopathies. We will look at the risk factors of the various cardiomyopathies. We will look at diagnosis and the treatment options. So stay with me. Let us learn these together. Cardiomyopathies are diseases that affect the structure and function of the cardiac muscle. Primary cardiomyopathy is idiopathic, meaning it has no known cause, and no other structures are involved. In secondary cardiomyopathy, it occurs as a result of another disease process, and it can involve other body structures. Now let us look at the three main types of cardiomyopathies. We have dilated cardiomyopathy, which is most common, hypertrophic cardiomyopathy, which can be obstructed and non-obstructed, and restrictive cardiomyopathy, which is most rare. In dilated cardiomyopathy, we have fibrosis of cardiac muscle tissue. The ventricles and atria appear dilated. The chambers of the heart are dilated. The clinical manifestations are fatigue, weakness, left-sided heart failure, emboli, S3 and S4 heart sounds, and cardiomegaly. In hypertrophic cardiomyopathy, we have hypertrophied walls. The walls appear thick. The chambers of the heart decreases in size. They appear smaller in size. The clinical manifestations include dyspnea, angina, fatigue, palpitations, atrial fibrillation, heart failure, S4 sounds, and sudden death. In restrictive cardiomyopathy, fibrosis results in restricted movement of walls, and there will be narrow chambers. These narrow chambers and restricted movement of the walls will result in inability for expansion or to expand and contract. The clinical manifestations include dyspnea, fatigue, right-sided heart failure, S3 and S4 heart sounds, cardiomegaly, and emboli. Let's now look at the causes and risk factors for each type of cardiomyopathy, and these ones include: for the dilated cardiomyopathy, we have cardiotoxic agents, coronary artery disease, hypertension, metabolic disorders, genetic, and this is autosomal dominant, muscular dystrophy, myocarditis, pregnancy, and valve disease. In hypertrophic cardiomyopathy, the causes can be aortic stenosis, hypertension, and genetic. And remember, it is autosomal dominant. In restrictive cardiomyopathy, can be caused by endomyocardial fibrosis, amyloidosis, sarcoidosis, neoplastic tumor, ventricular thrombus, and post-dilation therapy. The diagnosis of cardiomyopathy can be achieved through 1. Echocardiogram. An echocardiogram assesses the heart structure, the chamber size and thickness. It can also assess the structure of the ventricular walls and assessment of the overall heart function. Then we have electrocardiogram, what we normally call an ECG. An ECG will assess and detect any dysarrhythmias as well as other indicators of heart failure and cardiomyopathy. We have chest X-ray. A chest X-ray will depict cardiomegaly, the enlargement and the pulmonary edema if present. The X-ray will depict cardiomegaly, enlargement and pulmonary edema if present. Hemodynamic studies, these ones evaluate cardiac output and chamber pressures. Hemodynamic studies evaluate cardiac output and chamber pressures. We have coronary angiography. Coronary angiography evaluate the chambers, the valves, the blood vessels, and the coronary blood flow. We go on and look at management of different types of cardiomyopathies. We have dilated cardiomyopathy care. It involves pharmacological management. You manage heart failure using nitrates, diuretics, and ACE inhibitors. We will also use amiodarone, which is antidysrhythmic, to control dysrhythmias. We will use anticoagulant agents to prevent embolism. The assistive devices that can be used in dilated cardiomyopathy are implantable cardioverter fibrillators, and the surgical management is heart transplant. For the management of hypertrophic cardiomyopathy, the pharmacological management, we use calcium channel blockers and beta blockers to improve ventricular filling. Amiodarone again is used as an antidysrhythmic agent to control dysarrhythmias. We use digoxin. Digoxin, remember, in what we said in hypertrophic cardiomyopathy, we have the obstructed and non-obstructed type. Digoxin is contraindicated in obstructed form of hypertrophic cardiomyopathy. The assistive devices, we have atrioventricular pacing, can be used to improve outflow. Surgical management, we have ventricular myotomy, can be done, and this is removal of ventricular muscle. In restrictive cardiomyopathy, the management involves treatment of symptoms, management of hypertension, and exercise restriction. There is no specific treatment for this kind of cardiomyopathy. In summary, cardiomyopathies are disorders affecting the heart muscle and can be idiopathic with no known cause or secondary to another disease process. The main types of cardiomyopathies are dilated, hypertrophic, and restrictive. Diagnosis is typically achieved through echocardiogram to visualize the structure and function of the heart. Priority nursing interventions include symptom management, controlling dysarrhythmias, and managing underlying disease. Surgical measures can be used in both dilated and hypertrophic cardiomyopathies. Thank you for watching this video. I hope it has been of great value to you. We will continue posting more videos in our YouTube channel. Check us on YouTube, like, leave a comment, and subscribe. Bye.